Good evening and welcome to Metro Focus. I'm Jack Ford. The battle against opioids continues with a most disturbing fact. According to the Centers for Disease Control and Prevention, 2,245 New Yorkers died as a result of these deadly drugs just last year. That is almost an 8% increase since 2016. With this surge in death, city officials are once again amping up their efforts to combat these lethal drugs, and this time they're turning to the public for help. With a proposal of 3 new bills, Councilman Richie Torres is pushing for citizens to be trained in recognizing and actually treating opioid overdoses. Here with some more on this development is David Robinson, investigative reporter for LowHUD.com, a media network dedicated to New York's lower Hudson Valley region. David, nice to have you here with us.
Yes, nice to be here.
Let's start off with that number, 8% increase. Is that as shocking to us as it sounds?
Unfortunately, it's not. I mean, there's been a steady increase in the overdose deaths, for the past 15 years, really. I mean, this is an epidemic that's unfolded for quite some time now. And unfortunately, you're looking at those figures from 2017, and they're unfortunately likely to even go higher, because it's such a complex epidemic and public health crisis that we're actually looking at, delays in confirming the deaths and actually reporting the deaths. So I wouldn't be surprised if that number went even higher.
So this is not a one-time spike. This is just a steady climb, a frightening climb, but a steady climb we're seeing.
Definitely. And to be clear, most recently, some of these spikes have been precipitous. I mean, we're talking about some spikes year over year that are much higher than that 8% in the past 5 years, roughly. And some of that's due to the differences in kind of how the drugs are reaching those addicted on the streets and in their homes. And really, it's part of the idea that drug dealers are changing their techniques. They're cutting them with deadlier synthetic opioids. It's not just a heroin. It's something that's mixed with even more potent chemicals, fentanyl, analogs, different types of drugs that are really even that much more deadly. So that's where you're seeing, the real spikes in the deaths.
Let's talk about these proposals. And the idea, as I mentioned, is to bring the public on board as an aid in trying to combat this. And I'm sure a lot of people are saying, well, what could the public possibly do to help here? And talk a little bit about some of these proposals.
Sure. So they're based on the pillars that you're seeing kind of nationally of kind of, education, prevention, and then treatment. And these 3 proposals are kind of rooted in some of those that are out there already. Kind of the idea of training the public to be able to reverse overdoses with the use of naloxone, the opioid antidote or antagonist. And that's something that draws some controversy when you're talking about, potentially putting rescue kits on the street in public places so that people can go and access them and call 911 and get instructions on how to revive someone who's overdosing in a public place. You're talking about, training not just law enforcement and EMS, but daily citizens, in the model of what you're seeing with, CPR training or stop the bleed training, some of these ideas where it's reached a public health crisis level that is historic. And it's something that, it's that all hands on deck approach to basically, keep these people alive as long as possible, get them into treatment, and hopefully start turning the tide on this.
So would these provisions have some ability to actually provide some training to people? So it wouldn't just be, hey, if you see somebody out there, find a box and do something to help them.
Sure,
there would be some actual training.
And to be clear, they're not to the level of putting public rescue kits out in the street yet. There's been proposals in some of the harder hit states like Massachusetts and Ohio and some of the Midwest Appalachian states that have touched on the idea of putting them in public places. This is more on the model of what's already being done with our law enforcement, with our first responders, basically that they're undergoing training on basically using the naloxone when they identify an overdose victim. And this takes it to the next step. And it's basically having forums that are already available through the State Department of Health in a lot of settings. A lot of hospitals, a lot of clinics they have these regularly. And people who potentially are a family member or a loved one of somebody struggling with addiction, they're actually going to these trainings already. And they're saying, help us to keep our loved one alive as long as possible. And really what it entails is going to a course, getting the training, getting the rescue kit, which was something that had to be passed legislatively to make those available to the public, and basically saying, this is how you save lives. And unfortunately, we're already seeing numbers that come from the state for statewide are thousands of people who are being revived already. And so, it's only going to get worse, unfortunately, it seems like.
Are you seeing, as somebody who's been chronicling this story, as you know, early on there was some pushback over the idea of having these remedies available for police officers, EMS, people. And the pushback was, well, aren't we just kind of going to be saying to people now, it's okay for you to use, because if you have a problem, somebody will be there to salvage you, if you would, to resuscitate you, bring you back. Are you seeing, again, as somebody who has been reporting this story, that we've gotten sort of past that and people are saying, okay, you know what, we got to save lives here?
Yeah, I think that really gets to the heart of the stigma issue. The idea that, you go through any public health crisis throughout history, really, and you talk about, it reaches a point where everybody says they've been touched by this personally. Everybody knows somebody who's struggling with addiction, unfortunately. And that's where you start getting to we're past the stigma. People are saying, and there are still some who are always going to take that, tough love approach and say, you're encouraging it. But as a public health and a public policy issue, really, I think that's something that's of a past discussion, really. It's we've done reporting even just on people telling their own stories in obituaries. Families are starting to come out and say, we lost a loved one to this, and we don't want you to go through the same pain. And so here's what happened with our loved one. They struggled with addiction for this many years, and we want you to not go through the same thing. And those are big leaps. You're talking about a change in public thinking that really is something that's crucial when you talk to the treatment experts and kind of overcoming this. Getting rid of the shame, getting rid of the judgment, and some of those things, some of those hurdles that keep people from actually going to get help. That's really where you're starting to talk about, okay, the treatment people, the treatment experts are saying, that's what we needed. Now let's start, turning the tide on this.
David Robinson, you've done great reporting on this. We appreciate your coming in and sharing some of your thoughts. We'll talk with you some more down the road as we continue with this. You be well.
Oh, you too. My pleasure.